The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. Thank you for joining us for the Reporting the Unsheltered Homeless Population webinar. I am Amber Freeman, the Training and Technical Assistance Coordinator with the Connecticut Coalition to End Homelessness. So today we have a very informative webinar for you, but before we begin, I just want to go over some housekeeping. So because this is a webinar, you all are all muted, but you can please type any questions that you have inside of the questions box. And at the end of the webinar, we will have a questions and answer segment, and we will be sure to get to all of your questions. Also, we are recording this webinar, and the recording and the slides will be available in our webinar library at www.cceh.org. When you go to our website, you can go to the resource tab and click on webinars, and you will see a full list of all of our webinars that we have recently done. So for today's week, we have Carl Askenkanen, who is our Youth Systems Coordinator with the Connecticut Coalition to End Homelessness. We also have Linda Casey, the Director of HMIS and Strategic Analysis. David Gonzalez-Rice, who is our Senior Program Manager, and Madeline Ravitch, who is our Development Advisor. So I know we are very interested and want to see what the web app is about. But before we get there, I'm going to ask Madeline and Carl to discuss our newest initiative, MyTownCares, and speak to how that is, how it goes hand in hand with the web app. Also, David is going to speak to the safety considerations that you should have when using the web app. So I am going to hand it over to Madeline to get us started with MyTownCares.
Hello, everybody, and thank you for joining us today. We're especially excited to have so many different towns represented attending this webinar so that you can participate in the point-in-time count and make sure that you're actually collecting data that will be invaluable in making it possible for us to connect clients with services. This is part of a wonderful initiative that we've just launched called MyTownCares. We've launched it in collaboration with the Connecticut Conference on Municipalities and Sustainable CT. And if you haven't heard about it already, your town can actually get credit for participation in this data collection process. So an extra thing to think about, and you can learn more about MyTownCares at CT-HMIS.org. A little bit more about this initiative. We started it in collaboration with the Mayor's Homelessness Prevention Task Force, which was started by the Connecticut Conference of Municipalities, which, working with Sustainable CT, developed a roadmap for towns to address and end homelessness locally. That roadmap includes building awareness, strengthening your own town services, collecting data, coordinating with your local coordinated access network, and mobilizing resources. And it will include steps relating to important improving outcomes for people experiencing homelessness through decriminalizing homelessness and connecting with services. And just a little bit more, again, if you go to cch.org and click on the MyTownCares banner, you'll be able to click through to Sustainable CT Category 12, which is titled Effective Compassionate Homelessness Prevention. You can see all the different steps that your town can take and get credit for taking. Action 3 is what we're going to be focusing on today, which includes the collection of unsheltered data. And so we're just really pleased to have all of you. If you are an outreach worker who knows people, or anybody who knows people in other towns, please spread the word. Our goal is to have 169 towns participating in this in unsheltered data collection so that we really have an accurate picture of who's experiencing homelessness here in Connecticut now and for the future. And just a few words on this data collection process, which is a little bit different from last year's point-in-time count or the previous point-in-time counts that some of you may have participated in. Just a little bit about the point-in-time count. It's an annual HUD-mandated survey that normally takes place nationwide one night each January. Normally, we use volunteers to canvass census blocks. This year's approach will be a little bit different. The survey will take place anytime January 26th, not just in the middle of the night. as we usually do. Outreach staff will be serving in your area. So if you're an outreach staff person, we're really happy to have you here. Municipal staff will coordinate for their towns, and we'll be looking for an admin from each town to take the lead on making sure that there's no duplication of data in your town. But just the other fine point here that's really important is that we're really excited to be working with all of you this year, because our goal is to not only collect data as we've always done through this survey process, but also to connect clients with CAN services so that we can get them the help they need. So we think we have a great process this year and are looking forward to telling you a little bit more about it. And now I'll hand it over to Carl Assenheim to talk a little bit more. Carl is our lead for working with towns and cities. He can be, he's here to provide technical assistance, and also first and foremost to talk to you about what we're about Action 3 and collecting data on homelessness.
Awesome. Hey, thanks, Madeline, and thanks everyone for tuning in here today. We're really excited to provide this training. Point in time is really important statewide for identification, for data, and getting a sense about what homelessness is like and unsheltered homelessness is like statewide is really vital. So excited to be part of this. Today's, I want to just go directly, like Madeline said, continue on this thread about the municipal work. And Action 3 is like the most prominent one for us under this data collection piece. We are looking for information about all individuals and families in your municipality who might be experiencing literal homelessness or unsheltered homelessness. That's the goal of Point in Time, but then certainly that's also a new goal of the municipal effort is to try to find allies in each town. This information, for those of you who participated, you'd know this, but otherwise this information, it goes back to coordinated access networks, and it provides data about local data about individuals and or families who are unsheltered. We know that a lot of towns are struggling with this, and they might be outside of coordinated access networks or not maybe too connected to them, or they might be trying to problem solve themselves, which works in many ways, but we also want to open up to a broader system for you all across the whole state. We want to also share information from the data collection that you do at the municipal level via a form that I'll outline here rather quickly, and that actually we're looking for some of your input, I think in the chat function, but we'll get to that shortly. But we're looking for information from your town to be shared statewide to influence and to affect the point in time count. And we're also looking, as part of this process, and this is the third action, we're looking for you to submit a list of locations where you know people are unsheltered or may be experiencing homelessness, and then we want to follow up and survey those individuals in those spaces and/or families if possible. So that's Action 3. It's one of the primary actions that we released, and it's the most acute action because it relates directly to the point in time count. Amber, if we could go to that next slide. So this is the information that we're looking for from the municipal level. I believe that we're going to have a moment or some time where we're looking for this information from you in the chat function, but we're interested in municipalities who are here today. Again, welcome. You may already be connected with your coordinated access network, but if you're not, we're really interested in knowing who you are, and if you're willing to, and certainly what town you're from, and if you're willing to be a lead for the data collection around this important effort for point in time. And then we want you to think about, as Madeline may have said and that I just alluded to, we want you to think about locations where people are known to be or where they may possibly be staying, particularly for January the 26th, which is next week. So a heads up, we want you to think about this now. Think about who in your town could be an ally in helping us identify individuals and or families who might be unsheltered, and let us know your contact information so that we can engage with you post-webinar.
Thank you, Carl. I just put a link in the chat box for a survey that we would like you all to complete that has all this information. So if you guys can take a moment and do that, or feel free to save it and do it after the webinar, that will be great.
So refusing surveys, and DGR, David Gonzalez-Rice, will get into a little bit about safety, certainly, but we're asking clients who are unsheltered to complete a survey during this effort. And we just want to be clear with everyone who's listening to this, particularly if you haven't participated in PIT before, that this is a voluntary survey. In my experience, clients might not want this all the time, of course, so any client has the right to refuse the survey and any assistance that we're offering. We want surveys because we want to survey individuals because that is really good data, and it also places them in a geography so we understand that a little bit better. If you have, as a municipality, if you engage with clients who are not willing to take the survey, but you know that they're homeless, that we're reluctant to participate in the point in time count per our description and the way that we're conducting it this year, we want to know about that. And we want to be able to link up those refusers, which any client or citizen has a right to refuse that, with outreach workers to make sure that there are services, referrals available, and that they're on the radar of the coordinated access network in some way. So going forward, we just want you to know any client has the right to refuse. If someone does refuse, it doesn't mean that we don't want their information or that we don't want to know about them. But there are steps that we'll take in the future to engage with that person again. This is about being assertive in outreach. Awesome. Thank you. So in the short term, what we're looking for from municipalities is for you to think about who at the town level could be a participant or a partner in this effort. We also are looking for a municipal contact for each town to help us fill out, be the data contact for us. And we're also looking for connections to municipal employees in other towns. We are embarking on this work outreaching to 169 towns and through the CAN leadership functions, but we know that we can't reach everyone at the same moment, perhaps, or with the same message, and a lot of staff has changed. So we're just really also looking for your help about thinking broadly about contacts at the municipal level. If you have a strong contact for us in another town, please advise. And then really a broader goal, and we may speak to this, I think Linda may speak to this, but really the broader goal here is what we're trying to do is to create this system where we have a network and people in place at the municipal level and at the very local level who are working year-round to identify homeless people and referring them to services through the appropriate channels, be it coordinated access and outreach workers, etc. So this is a one-night effort, January 26th, but it's leading to, and we're trying to get to a point where town by town, throughout the course of the year, we have allies and partners in place who can really, who understand who might be outside and unsheltered and can communicate that back to the coordinated access network and can supporters. So the goal is to be able to do point in time when we want, frankly, without the survey, but knowing who it is that's outside and unsheltered in our own in our own municipalities and at the town level. Awesome. So this last slide for me is my work, like Madeline alluded to, is I absolutely could support facilitating connections with CAN resources and the coordinated access network leads. Absolutely, I'm also providing technical assistance for the Sustainable Connecticut certification for Category 12 around addressing homelessness and our 5 steps and actually 6 steps. So I'd be happy to talk to any municipality about the content there and the goals that we have and how this lines up with the calendar of work that we're doing. And then we also have, I'll just call attention to, we also have a training on February 4th that's a kind of, we're calling this a nuts and bolts training for municipal leads and folks within the Sustainable CT network who want to engage in these actions to address homelessness in their town. So please mark your calendars for February 4th. We'll have some more information coming to you. And we really appreciate your participation and willingness to support CCH in this effort as part of a broader statewide campaign, and just really looking forward to participating with you at the town level. So thanks again for your time today.
Thank you so
Thanks
much.
very much, Carl. So good morning, everyone. I'm going to expand a little bit on some of what Carl touched on in terms of the voluntary nature of the survey. I also want to acknowledge here, kicking off this piece, that this is a very diverse audience. So a number of you are newer partners to this exercise who've responded to our municipal outreach. Some of you I also know from talking to regional coordinators of the point-in-time count are longtime partners who've participated in the point-in-time count before, but expect that yourself or one of your staff or collaborators will be entering data outside of HMIS. Your agency uses another electronic health record or database, and so you're using this portal as part of your region's effort to do all of that data entry. So some of these points will be familiar to many of you, but I'm also aware that given staff turnover in this field, you may be ramping up new staff, again, partnering with new partners. So, you know, both for our new and veteran participants in homeless outreach and the point-in-time count, just want to briefly draw your attention to some things that are really important to keep in mind. So for all homeless outreach, best practices include a very non-judgmental approach, kind of a very neutral way of interacting with and responding to somebody who's currently experiencing a real crisis state due to living outdoors or in a place not fit for human habitation. All services are voluntary. Outreach is voluntary. Participating in this survey is voluntary for the client. And then, as I learned, one of our mantras among permanent supportive housing case managers was services are voluntary for the client, but not for the staff. And that's why outreach is persistent. Carl said assertive. These are ways that we talk about how homeless outreach is done over time, that what assistance we have to offer at a given time might not be acceptable or attractive to the person we're trying to reach out to at that moment. And then the responsibility remains with our system, and especially with some of our programs who have an outreach expectation, to reframe that offer, find other options, come back at a different time of the day with a staff person who has a different personality, whatever it's going to take to try to find out how we can meet that person where they are and find an offer of assistance that's going to take for them. Respectful and responsive to difference. So in addition to cultural competency, the fact that so many people living outdoors either experienced serious trauma that led to an experience of homelessness or that follows their experience of homelessness. One thing to just bear in mind at all times is that homelessness looks as many varied ways as you can possibly imagine. One thing in particular you hear from people who are experiencing unsheltered homelessness might be that there's some part of what they're going through that they might describe as a choice, right? They might say, well, I know where I could get shelter, but I like it better out here. I prefer to do this. And I've sometimes heard from community partners, well, you know, some of these people want to live that way. And so, you know, you might feel what do we have to offer? What can we do for somebody who sees what they're doing as a choice? And I always remind people when this comes up that in the United States of America, especially, again, being the master of your own fate, choosing your fate, being in control of your situation are all very strong cultural values. And I think a lot of us, when we experience things that happen to us, find ways of redescribing them as things that we've taken control over. People experiencing homelessness are no different in that respect. So whatever, way somebody has of describing their story or coping strategies they have to make sense of what's happened to them and their situation today, our responsibility is to understand the things that constrain their choice. Lack of affordable housing, inadequate social safety net, and even personal trauma, whatever combination of things it is that puts somebody in a circumstance that just isn't safe or acceptable. We've got to keep working through that and be persistent in our outreach. When these slides go out, that link on the bottom you'll find redirects to a good resource out of the United States Interagency Council on Homelessness. So any of you that are looking to kind of keep an outreach effort going, get more tied into collaborative outreach, I'd encourage you to take a look at that, and you can find that from our website as well. So for safety considerations, we always encourage in the volunteer effort. And again, some of you might be newer partners, some of you might be working with staff or collaborators who've not been part of this effort before. You might be renewing your outreach push to go check in on places where you haven't been in a little while. So just always want to encourage you, don't take this kind of point in time or this sense that we're trying to get the most complete count that we can. Don't let that override your general year-round judgment about what is a safe situation and what isn't. We have a bigger window this year. We're not trying to fit things within just a few hours. So, hopefully you're not in a position of having to try to think whether you want to talk to somebody who looks agitated or somebody who's asleep. Hopefully over the course of the day, you can check in with the people you're already aware of and approach people in places where you think it's likely some of them are experiencing unsheltered homelessness and find them at times of day when they're in the right state to be talking with. I want to remind you just to be aware of who's in control of a property, who's the property owner. Seasoned outreach teams often are working with people and encampments that might be located on public or private property and are in touch with the property manager. So if heading into next week, you're doing some renewed outreach or a new outreach effort to a place that you've heard reported about but haven't actually been to, please remember to at least communicate with that property manager, and when in doubt, don't trespass. And then finally, we would typically send volunteer canvassing teams out in groups of 3 or 4 with a previous volunteer or a professional outreach worker or similar social service worker heading up each team. We can't do that this year, and many of us are working in more isolation anyhow. Do still try to find a way to partner up with a coworker, with a colleague, whenever you're approaching someone who's experiencing unsheltered homelessness, especially if it's a new person, not a current client. And Carl alluded to a lot of this, so I won't belabor this, but use your good social work interviewing techniques here, right? We want the quality outreach to really drive the quality of this exercise and let the good data follow. So, be conversational. This isn't really a formal census exercise first and foremost. It's about trying to identify and account for everyone we know to be experiencing homelessness in our community. Do ask for permission. Do stop the interview at any time the person indicates they don't want to continue. You keep offering those opportunities for somebody to answer certain questions, but not others. You could always put that a data element was not collected, and we know that that's often true for this population in particular that's not come into shelter. So you can skip questions. You can reread the question. Try to be, again, matter of fact, straightforward with the interview piece, with minimal interpreting or explaining of questions, and just do what you would do for a good kind of assessment in your intake packet or whatever comparable thing you have in your process in your work. And over to the last slide. We find that people, more often than not, in outreach work or when I was supervising homeless outreach or helping to coordinate homeless outreach, we find more often than not that people we identify have previously been engaged with 2-on-1 or with the coordinated access networks. They are also often closed cases or cold cases. So we don't want to treat this interview as a totally isolated thing. It helps to ask whether the client is called 2-on-1 or connected to the CAN recently. They may still have a navigator in the CAN who's assigned to them. They may, their name may be sitting somewhere on a list for priority for shelter. You can always offer to help them call. 2-on-1 staff are knowledgeable about things like winter shelter spaces, where they're available, particularly if we happen to be in a governor's cold weather order, which we're not currently, but do pay attention to that. If you're helping somebody call 2-on-1, the trick to make sure it's triaged as an emergency housing call is to call 2-on-1, press the prompts for 3 and then 1 and then wait. If you press anything else after that point, it's treated as a more general housing call. And then you may know in your professional capacity, even more than the 2-on-1 staff do, what some of the local processes are for triage and prioritization for resources. So do just check in about that, try to be knowledgeable about it. You may identify things that need some follow-up. Often what a client reports they experienced with 2-on-1 in the CAN starts a puzzle that the answer won't necessarily be clear that day. So remember, Carl Asikain and myself, especially for you who are working in municipalities, to reach out to Carl and let us know, what you heard that you couldn't get a quick answer to, and there may be some follow-up items that are needed from that point forward. So with that, I'll wrap it up. I'm going to hang out, and you can, of course, send your questions to me, and we'll take it over to the data piece.
Thank you, David. And I have a few slides to talk about before we get into the actual demonstration of the web app. So Amber, if you could get back to the slides. Or I guess I can show the slides. Just open them. All right. Working our way through. All right, can everyone see my screen? All right, not hearing a no. So just a few slides to go through before we get into the actual demonstration. So the Unsheltered web app that we're going to talk about today, that you'll see today, is really intended for non-homeless management information system users. And probably the majority of folks on this call don't have access to our statewide homeless database, which is the HMIS. So this is piloting. We're going to pilot this web app for about 3 months, see what works, see what doesn't work, and then be able to roll it out and figure out any of the challenges that we may have. We don't expect any, but I'm just saying, just so folks know, we'd like your feedback. So as you use this, know that this is something that we are working to improve. So our goal is to use, as you heard both Carl and David say, year-round data for both HMIS and non-HMIS users, and having a mobile ability to do that. All information that I'm going to talk about today that relates as it does to the PIT can be found at that URL on the screen, cch.org/PIT/overview. So why do we collect this data? I'm not going to spend too much time on this. You did hear this, but it's really 2 points. You've heard a lot about the annual point in time count. You heard about that federal mandate that we have to do this. Every state does this every year, usually last 2 weeks in January. And we're certainly going to do that this year. Obviously, things have changed because of COVID. But the other thing that you have heard as well is that this is our attempt to capture unsheltered data year-round, really involving the towns across the state to help us understand who's unsheltered in their towns. Nobody knows that better than you do. We certainly have outreach workers who are across certain parts of the state, but not everywhere. So we want to make sure we have enough outreach staff and really be able to provide services to the folks that are experiencing unsheltered homelessness. So this is our way to really step forward and have you partner with us to get those numbers. So when we talk about the web app process, just want to remind folks, if you are on this call and you actually are part of a CAN or you have a coordinated access network contact, make sure that you use your contacts, whether it's an outreach worker or whether it's a CAN staff member, and really work with them if you know if there's someone unsheltered in your area before using the web app. Again, we really want to streamline the process so someone who has access to HMIS can actually double check this before you enter any data. So again, check with your CAN contact if you already have one to make sure the person that you found is already in the system. If you don't have a contact, that's okay. That's why we're here. That's what the web app is initially used or will be used for. We also have a paper survey that is available on our website, that URL that I mentioned just previous slide. So you have multiple ways you can enter the data, whether the web app or the paper survey, and you can contact this email, data@cch.org. If you have questions or if you choose to upload a web paper survey, we'll give you a secure link to do so. So just to remind folks, anything that you enter in this web app is not automatically a record in HMIS. There's going to be an intermediary step to vet the data to make sure that it is not duplicate, that we already don't have the person in the system, so just make that clear. And again, all the data that is entered in the web app will be reviewed by both us here at CCH, the data team, and the CANs. We will work through the process. So real quick, the survey, it's really simple. There's 5 main sections. Again, the paper and the web app are going to be the exact same thing. First section is demographics. Then we talk a little bit, asking about their homeless history, asking about any disabling conditions, families and dependents. You can add as many families and dependents as they have. And I want to spend some time on the release of information because that's very key as part of our normal process. So how do you complete the survey? We'll talk about the registration, but once you log in and are on a new record, you need to select the town that you're in, because so that way we understand where you're surveying and we can be able to direct it accordingly. And again, as you heard other folks, David say, certainly, and Carl say, enter as many fields as you can. This is not mandatory. You'll notice there are very few required fields. And really, if the person that you are talking to is uncomfortable with anything, then you can skip that question or skip the survey. We do not want any observational surveys. And if you have been part of the PIT in years past, that was an option available to you that you could literally not actually engage with the person, but you can actually look at them and make your observations and complete a survey that way. Just make it clear, we are not looking for observational surveys. This is not a traditional PIT or data collection that we plan for year-round purposes. We really want you to engage in them. If you don't feel comfortable engaging, please inform either if you have a CAN contact or a regional coordinator, or if you're part of a municipality, contact the folks that are in your area about the person and the location, and they can figure out the next steps that are appropriate. The release of information is our legal language that literally allows folks to agree to the terms to get everything that they have entered in this survey or responses they've submitted in the survey into our system. This is a very important part, and so I'm going to spend some time on this, and I'll show you how it works in the web app, but this is a required field. So the question that you have that you will see on the web app is really asking the person if they want to share their information with us, the Connecticut Coalition to End Homelessness. And you'll notice that there's a yes to display. They say yes, then the actual content for the ROI displays. You would then read that content to the person, and they can either agree or reject those terms once they've heard the full ROI. People who accept the ROI, what this means is we can actually get their data into the HMIS. And people who reject the data we cannot enter their records into HMIS, but we will be able to contact the CANs and have follow-up for that person. We will be able to use the de-identified aggregate data for the purposes of PIT, but we will not enter them into the system. So again, this is an important piece, certainly for our day-to-day with our clients. Registration. So how do you register for this web app? It is live. It is ready for you to use. If you go to cceh.webauthor.com, you will be able to see a registration link. And then once you register, you can log on to any mobile device. The one thing I want to say is it is called a web app and not a mobile app for the reason that it is literally a web-based browser, but it functions like a mobile device, meaning you don't have to be near the internet to actually enter data. You can actually enter what you have, and then it will connect once you are, we will upload once you are connected to Wi-Fi. So that's a really big difference, because you think about folks who are going out, such as yourselves, and really in places that may not have Wi-Fi connections or internet access. You can still enter this information and be able to have it upload once you get to a connectivity. I do want to mention, as you register, you will only see the clients that you have entered. So you will not see, let's say there are many other people in your town who are doing the same thing. You won't see their records. You will only see the records that you have created and be able to edit the records you have created. As you heard at the beginning of the webinar, we are looking for area administrators, specifically for the towns and municipalities. This is going to be a really key piece, that each town, that we know who the admin is for that municipality, because we will then give them the ability to see all the records for their town and be able to see, oh, actually, we see that several people identified the same person on the corner of Main and Church Street, and be able to adjust accordingly so that we don't receive all the duplicate records. So that's going to be a key role that we would like every municipality to identify who that person is. And again, you saw that survey come through. Please take a moment. If you haven't done that, you can contact us again at data@cch.org if you have any questions in addition to that. For those who are visual, I just put a little flow chart together just showing how you really should interact with the web app. So once you locate an unsheltered individual or a family, again, remember the first question is, do you have someone in the system that can contact, a coordinated access network contact? And if you do, then you really, I forgot the yeses and nos here, you should reach out to that CAN person and ask them to confirm this person's existence in HMIS, and if not, to enroll them, and they will take charge of that. If you don't, then you can create the online account, select your town, and we'll walk through the steps of logging in, what you need to select for outreach, selecting new records, completing the form, and submitting. All right, so a couple screens here. This will be a live demo, but this is just a couple screens for your review. cch.webauthor.com, again, is the URL. You'll see the login there, and you can see register now if you do not have a login, and it'll just ask a few questions, name and email address, and this is just so we know with each record that comes in if we have questions who to follow up with. All right, and now time for the demonstration, and I will switch over to the web app. So when you log in, I want to mention I'm obviously on a desktop web browser, so I do not have the GPS as accurate, so I will not click that. But I want folks to know, obviously, if you're using any mobile device, you have the GPS built in, and that's a key feature here. So once you log in and select your town, you can select if this person, if you're doing for the pit, if they are unsheltered the night of the pit. And then again, you can put in a location here. So I can put in, if I select a new person here, and put in a corner or an encampment or what have you. So you can, again, put a description in the location. And again, as you go through this, you can actually do your geolocation tag if you are on any mobile device out in the field, and that will pull up a map right here. So this one is a test record. You can see first name is the only required field that we are requiring in this section. Remember, there are 5 sections to each of the surveys. The first one is the demographics. You'll notice options to put in if someone has refused their name. You can click that. You can say if they don't know. I mean, you have options, again, pretty intuitive, pretty easy. Same thing for date of birth, easy to select dates and select them. Contact information, again, if there's what the gender is, ethnicity, and you can choose multiple race. We know the race issues. We are looking to expand these lists, but this is currently the HUD list, so this is what we are limited to, but you can actually multi-select. Okay, the second section talks about the history of homelessness, so how long the person has been homeless. You can see here again various drop-down options, and you can put in the number of years or months. The time they have spent in shelter, again, various options that you can select from, how long they've been on the streets and how long they've been living in this community, aligned for each, either it's years, months, weeks, or days. For the disabling conditions, again, folks can see, as you click, you'll see various options, and you can just select the appropriate one. If you select yes, you will see that there is a subsequent question that will pop up. in terms of whether or not the ability, this disability rather, impairs their ability to hold a job or live independently. So you will see, again, the logic is built in. You have the ability to add families and dependents, and I can select who the household member is. Again, select their date of birth, select the gender, race, multi-select ethnicity, whether or not they're a veteran, and if they have disabling conditions. And you can add as many family members as needed. And the final thing I want to show in this fifth and final section of the mobile app is that, or the web app, is that this is the ROI that I mentioned. You can see it's a required field. This is important. This is the question you asked. Would you mind if I shared your information with the Connecticut Coalition, Connecticut Homeless Management Information System? This will allow agencies to help you and provide you with services. If the person says yes, you'll notice that the release of information content displays. You can read this to them. And if they say they agree or they refuse, you can indicate that here. The final, this is just a nice little feature after saving. Let's say you have multiple people that you'd like to enter in. You can choose exactly where you'd like to go. You can add another, you can go to the results list, a new record, what have you. So we're going to select results list. And I just want to show folks that you will have the ability to see all the records that you selected, either through selecting that last option when you complete a survey, or you can go into records and click on recent, and all the records that you have created will be here. You can select one or all, and you can actually click on modify to edit any information if it's changed, or if you realize you wanted to, it wasn't correct, you wanted to change your answer. So those are the high level features. Again, there's more. You can customize your dashboard. There's a lot more information, but I think for the purposes of this discussion and looking at the time, we'd like to save some time for questions, but just at least give you a sense of what the web app looks like, get you familiar with it, and get you using it. So with that, I will stop sharing my screen, and Amber will take it away for any questions.
All right, thank you so much, Linda. We have a few questions that came up. I'm going to go to that. We have a few questions that came up. Please feel free to input any questions that you have, but I will read the ones that we have so far. So a few people, well, for one, I just want to tell you, Linda, several people are saying that you're a rock star. So let's put that out there first. Yes, our data team is great, led by Linda Casey.
Thank you.
So someone's asking, how would they go about getting in touch around participating? How would they start the process?
Is that participating in the overall program for the municipalities?
Well, they are not specific, but if you can speak to the municipalities, and actually we do have a few people asking, how will they get connected with the MyTownCares? What's the first step?
I will pass that to Madeline. I think or Carl. I think they are the contacts for the municipalities, so better qualified to answer that than I am.
Yeah, so I would just chime in and say we may have already outreached to you. I would say if you are a municipality and you're wondering how to get connected, to just feel free to outreach to me and or Madeline about this. Again, we've started outreach to all the coordinated access networks and their contacts, and almost all 169 towns. So you may have had we may have already outreached to someone in your town, but if you're wondering how to be involved, just send Madeline or I a message, and we'll arrange a time to do a quick chat with you about the municipal campaign, the steps going forward, the longer term efforts that this represents, and then also the acute efforts of the point in time. So outreach to me. I'd be happy to help you.
Great.
And Carl's is the first email on this slide under MyTownCares, so please do reach out.
Thank you. And I guess, David, this one is for you as far as how can someone get assigned a CAN contact?
Great. So if you're working in one of the regions, you need to know who in your CAN is the right person to be talking to about outreach. I'm spending a lot of time in the next week checking in with the CAN points of contact for homeless outreach and the point in time count regional coordinators. Sometimes they're the same person. So email me and I'll try to make that introduction for you. It can be a moving target. So we'll try to point you in the direction of the person who's got the ball, you know, this month.
Great, thank you. And I'm sorry, several questions are coming through, so I'm trying to make my way through them. Question for you, Linda, regarding the flow chart. Are they expected to call their CAN contact with every individual that they come across to verify if they're in the HMIS already?
I think you have to take it on a case-by-case basis. If you start this process and you realize that you're in an area that has perhaps an outreach person who is aware of that, I think it's a good practice to know who that CAN person is and realize that maybe for the first few folks that you find, to confirm, saying, hey, I found this person, do you know about them? And if you get, yep, we know, that then you may want to move to a different area or canvas in perhaps a different town or, I mean, a different region. If you, however, find a few folks and people are not aware of who they are, they cannot find them in the HMIS system, then you'll get a pretty good sense that you are entering folks that we don't know about. So that then you can have absolute confidence to get them into the web app. But it's again, it's not as though every single time you have someone you should really contact your CAN, but I think get a sense of how widespread are the people that you're finding known to this system. And I think that you're going to find, again, this is a pilot, we don't know the answers, but I think you're going to find that people you're either going to get a sense of, yeah, we know a lot of these people, in which case, you know, enter them anyway. Always, if in doubt, I'd rather have you enter them and we can dedupe them, that's fine. But really just get a sense of, and again, this is something that, as David just said, it's a really moving target. We are learning who the outreach folks are. In addition to the fact that there's more funding right now, so we're going to be adding more outreach people. We're trying to put all these data points together and understand where do we not have coverage. No one really knows that. If in doubt, err on the side of getting the person into the web app, and we'll take care of it. If you can, again, just for your own curiosity, like make sure that you understand if you're in a region that maybe you already have coverage. First few folks, maybe find out from your CAN.
Great, thank you. For the pit on the 26th, is there any particular time that they need to input this information?
No, and that's a great question. I want to make this very clear. This year is different than any other pit you've ever had. In the past, and for those who are familiar, pit was a very set number of hours, and it was the evening of and the morning after. Forget that. You can start entering people into the system today, this afternoon, this hour. And the only thing that we are asking you to do, if you do that, is that just make sure you have a second sighting somewhere on the 26th. Sometimes make sure they were actually unsheltered on the 26th. And I want to caveat that by saying we are also extending that by 2 weeks, so 14 days after the 26th. If you can still verify that person was unsheltered, anybody you found was still unsheltered the night of the 26th, that's the key. And let me just back up for a second. HUD mandates that we do, as you keep, a point in time. So our point in time this year is January 26th. Doesn't mean you collect the data on the 26th for this year. You can be collecting it. We're going to be looking at all the records that have already been in the system since the past year. But the outreach folks, the same way that you're entering folks, the outreach folks who do this professionally are going through their clients and making sure that they were obviously it's early. Next week, they'll confirm, were you still unsheltered on the night of the 26th? So think of this as just a stake in the ground. You do not have to wait to enter the data on the 26th. Just make sure that if you enter them before, and if you enter them 2 weeks after, that they really were unsheltered on the 26th for this year. It doesn't mean you stop collecting data after the 26th or after the 14-day window after. We are hoping you're going to keep entering data year-round. When next year rolls around, there'll be another selected date in January, and that you'll do the same thing. Anybody that you found that you entered, are they still there? Are they still unsheltered? I hope that clarifies what the differences between this year's methodology and previous years.
Great, thank you. our questions have actually slowed down. So I guess we'll take a pause. Is there anything else that we might need to clarify, or you want to add anything additional?
I just want to add that on our website, again, the CCH, if you go to the point in time account, and we have a dedicated page, either by the end of the day today or by tomorrow, all of the information, including videos on how to do everything that I showed you today. There's a quick start guide that we'll be posting. So it's your one-stop shop for everything PIT related. Just make sure that you check that out if you have any questions. I think you'll find a lot of information there.
Great. Thank you so much. That looks like that is the end of our questions. So I just want to point out what is on our screen. The contacts for MyTownCares, if you are interested in participating in that, or if you would like some technical assistance around that, that will be Carl. That is his email address. If you have concerns regarding outreach or safety or connecting to a regional coordinator, that will be David Gonzalez Rice at dgrice@cch.org. Web app survey questions will be data@cch.org. And if you have any additional questions about training, any follow-up, anything else, you can contact me at training@cch.org. And we do have our standard questions with, will the slides be available? Yes, they will. They will be in our webinar library on our website at www.cch.org. You go to our resource tab, you go to webinars, you will see the recording as well as the slides. And the recording will also be emailed out to you all as a follow-up right after this webinar. I'm sorry, tomorrow. But I do not see any additional questions. So at this point, we are going to close out our webinar. So thank you all for joining us, and feel free to contact us, and take care.
Thank you.